Joint replacement is actually a misnomer. It's a term that we use in our society, but it's actually not an accurate representation of what we do. It's actually joint resurfacing. So we're actually not replacing anything. What we do is we remove the arthritis from the joint, and then we put metal and plastic in between the joint surfaces, so that way the bones aren't rubbing on each other. So to really say replacement, we think like a kidney replacement or a valve replacement in your heart or any type of other, million medical procedures where things are actually replaced. That's actually not the case. It's more resurfacing. Hip replacement surgery itself has been called one of the most successful surgeries invented. It's incredibly successful. It's probably one of the best surgical procedures that we do in orthopedics at eliminating pain, or at least decreasing it substantially, and increasing someone's functional ability. Knee replacement, I would say, is right behind that. They're very successful surgeries. They have great outcomes. Knee replacement is a little less than hip replacement. For some reason, 80% of people that have their knee replaced love it. They're very happy, pain-free, and totally functional, and think it was the best thing that they've ever done. About 20% of people, they're happy, but not thrilled. It's just something maybe isn't exactly right, but they're better than they were before the surgery.
Almost everyone will tell you the hips are a walk in the park in comparison to knee replacements. Knee replacements, fantastic outcome. 9 out of 10 people thrilled they did it, and they would come back for the other knee if they had 2 bad knees. But definitely one of the more difficult recoveries that we do of all of our orthopedic surgeries. You're often on a walker for somewhere between 2 and 6 weeks after the surgery. If it's your right knee, for instance, you can't drive for a minimum of 6 weeks. You simply can't operate the vehicle safely. Hip replacements have been known to walk out of the hospital on day 2 or 3 with a cane. It's a dramatic difference. We're not quite sure why, but the hips are also highly successful in the long term, but the short term they seem to be a considerably easier recovery. Shoulders are, my personal experience and what most of my patients say is that the pain level drops dramatically almost immediately after the surgery. It's just that shoulders are such a high functioning joint. They have the widest range of motion in the body. It takes a lot of time, 4 to 6 months at least, to regain the function that you are hoping for. Of course, people have gone years and years of steadily losing function before they generally have finally had their shoulder replacement. So it's almost always a very satisfying outcome.
Anytime you do a joint replacement, the outcomes, I think, have to boil down to pain relief and function. And that is not something the surgeon gets to judge. The patient gets to judge how much pain relief there was and how much function they have. And I think that's a fair, valid, assessment. Of course, we want the surgery to go well with no complication. We want the x-rays to look good in terms of the size of the parts and the position of the parts, and avoiding complications of infection or fracture dislocation. But ultimately, it is pain and function. So can you do more activities than you could before? Classically, patients with shoulder arthritis have difficulty working away from their body with reaching over their head or out to the side. They can tend to manage with their arms at their side, but that's not very functional. So if they can do their hair, if they can hang a picture, if they can use their upper shelves, if they can thread a belt, get their wallet, reach into the back seat of the car, that's a marked improvement in function, especially if it doesn't hurt anymore like it used to. So it's always going to boil down to pain and function, and the patient is the ultimate judge of that.
A successful joint replacement is one that moves well, that has minimal to no discomfort, and allows the restoration of activities of daily living. So being able to go up and down stairs, being able to get out of a chair, being able to do housework, taking care of yourself. That's what a successful joint replacement is. People that go beyond that and are even more successful, they're back to riding a bike, they're snow skiing, they're golfing, they're doing all of the recreational activities that they love to do, and that's very, very, very common. I would say the majority of people have that ability to start enjoying or even do more activities than they were recreationally, but really that's not what joint replacement was designed for. Joint replacement was designed for the restoration of activities of daily living, not so much the recreational stuff. But we found that most people can.